Welcome back for another deep dive with us. We're going to be looking at something pretty complex today. Radiological abnormalities in the cervicothoracic vertebrae, specifically in warm bloods.
Ah, the C7T2 region, yeah, where the neck meets the chest. Always a source of wonder and frustration for us equine vets.
It really is. And we're dissecting a 2024 research article to help us understand it better from Veterinary Radiology and Ultrasound by Dyson and their team. And they really took a deep dive into what's going on in these vertebrae when things start to go wrong.
Sounds a bit like our podcast today.
Yeah, exactly right.
Yeah.
You ready to get into the nitty-gritty?
Absolutely, let's do it. Let's unpack this complex area.
Okay, so they looked at 127 control horses and 96 horses with neck issues.
Okay.
All warm bloods, all at least 3 years old. Now, the cases, as the researchers called them, included horses with a whole mix of problems. Neck pain, stiffness, lameness that can be traced back to the neck, and even ataxia, which affects balance and coordination.
Yeah, that's a good mix of clinical signs there. And it makes sense when you think about how problems in this part of the spine could lead to all those different things.
Exactly, and the researchers were really careful about their methods, too. They used strict clinical and radiographic protocols to make sure they were comparing apples to apples. You know, it's all about that solid data.
Right, gotta have good data.
So let's start with something that might surprise you. You know those spinous processes, those bony bumps that you can feel along the horse's back?
Right.
I always thought they were just kind of inert structures, but this study suggests they might be more important than we thought. They found that a prominent C7 spinous process was actually more common in the horses with neck problems.
Interesting. Yeah, and the researchers did point out that it wasn't statistically significant, but the trend itself is worth noting.
Why do you think that would be? You'd think that horses with neck issues would have less prominent spinous processes, not more.
Well, that's a pivotal question, isn't it? It kind of challenges our assumptions about these structures and how they relate to neck function. It makes you wonder if maybe horses with certain types of neck problems are using their muscles differently, which could lead to changes in the spinous processes. Or maybe there's a developmental component we don't fully understand yet.
It really makes you rethink things, huh?
Definitely.
Okay, so then there's the T1 spinous process. And the study found a lot of variation in how it was oriented. In most horses, it was vertical, which you kind of expect, right?
Mm-hmm.
But in some, it was inclined cranially, meaning it was pointing slightly forward, and in others, it was inclined caudally, so pointing slightly backward.
And here's the interesting part. That caudally inclined T1 spinous process was found only in the horses with neck problems.
Wait, so you're saying the direction that bony bump is pointing could be a clue that something's wrong in the neck?
It's a possibility. The finding definitely suggests there could be a link between the T1 spinous process orientation and those neck issues. Now, whether it's a cause, an effect, or just a correlation, well, that's something we need more research to figure out.
It's like a detective story.
Yeah.
Every clue leads to more questions.
That's science for you.
But it gets even more interesting. They found that a caudally oriented T1 spinous process was more common in horses with spondylolisthesis at C7T1.
Oh, wow.
Yeah. So that's where the vertebrae are misaligned. So now the question becomes, is the bone adapting to that instability, or is it a sign of some broader developmental issue?
Yeah, it really highlights the domino effect we see in these types of cases. One problem can lead to another, creating a whole cascade of issues. So a misaligned vertebra could put stress on those surrounding structures, like the spinous process, causing it to adapt and change over time.
Okay, that makes sense. So we've got these spinous processes that are maybe telling us more than we thought.
Right.
But what about the connections between the vertebrae themselves, the articular processes?
Ah, yes. The articular processes, those little wings that project out from each vertebra and interlock with the vertebrae above and below, kind of like guiding rails that control how the vertebrae move in relation to each other.
Okay, I can picture that. So what did they find out about these guiding rails?
Well, they found something called modeling, which is basically bony enlargement.
So they're getting bigger.
Exactly. Think of those articular processes getting thicker and bulkier.
And they saw this modeling at both the C7T1 and the T1T2 joints. But severe modeling at C7T1 was significantly more likely in the horses that had neck problems.
Right, and that's important because it tells us that not all modeling is the same. Severe modeling probably means there's a more chronic or significant process happening in that area. Could be long-term inflammation or abnormal stress on the joint. Something's causing the bone to react in a more pronounced way.
So if you're looking at an X-ray and you see those beefed up articular processes at C7T1, that's a red flag.
It definitely needs more looking into. It's a sign that something's been going on in that joint for a while, and it could be part of why the horse is showing symptoms.
Now, here's where things get a little strange. Some horses with spondylolisthesis at C7-T1 actually had smaller articular processes than what's considered normal.
Yeah, that's interesting, isn't it? It really makes you wonder if those smaller processes might be less stable to begin with, making those horses more likely to have misalignment in the first place.
Huh?
Or could it be that the misalignment itself, over time, changes how those articular processes develop?
That is a pivotal question. It seems like the more we learn, the more questions we have.
That's the beauty of science, right? Each discovery just leads to more questions and pushes us to explore further.
Okay, so we've got spinous processes that might be adapting to problems. We've got articular processes that can be too big or too small. It's all starting to feel a bit like a puzzle, isn't it?
It is a puzzle, and we're just starting to figure out how the pieces fit together. But each study like this gets us closer to a clearer picture of what's happening in these complex cases.
And speaking of puzzle pieces, let's talk about that spondylolisthesis we keep mentioning.
Yeah.
That's not just a fancy word, is it?
No, it's not.
It actually has some pretty big implications for these horses.
No, it's not just a fancy word. It's a misalignment of the vertebrae, where one vertebra slips forward in relation to the one below it, and that can really cause some issues.
So it's not just that the bones are out of place, it's what that does to everything else.
Exactly. Think about it. The spinal cord runs right through that canal formed by the vertebrae. So if they're not lined up right, it can press on the spinal cord. And then you start seeing those neurological problems we talked about. Ataxia, weakness, problems with coordination.
Right. And the study actually found that spondylolisthesis was a lot more common in those horses with neck problems at both C6, C7, and C7-T1. And most of the time, the vertebra was slipping forward, what they call ventral displacement.
Exactly. And when that happens, that ventral displacement, it kind of has this ripple effect, and it changes the biomechanics of the whole neck. It puts stress on the ligaments, the muscles, even those discs between the vertebrae.
Which leads us to another big thing they found in the study, discospondylosis. That's the degenerative changes in the discs, right?
Yeah, those little cushions between the vertebrae. And this is where things get really interesting. The study found that discospondylosis was way more common in the horses with neck problems. And not just in one spot. They saw it at C6, C7, C7-T1, and T1, T2.
So it's more widespread than you might expect.
Exactly. It really shows that in horses, this discospondylosis can be multifocal. It can affect multiple levels in the spine, not just one isolated spot.
Which makes sense if you think about that domino effect. If you get instability at one level, it's going to put more stress on the discs above and below. And over time, that can lead to degeneration.
Right. And get this, over half of the horses with discospondylosis also had spondylolisthesis.
Wow. So they often go together. That's got to be rough on those horses.
It really is. And it makes you wonder, which came first? The degeneration or the instability?
Yeah. Is a chicken or the egg kind of thing.
Yeah.
Did the disc degenerating make the joint unstable? Or did the instability cause the disc to wear down?
It's hard to say.
And figuring that out is really important. Because if we understand what's causing these problems, then we can start thinking about how to prevent them or treat them more effectively.
Absolutely. That's what future research needs to look at, those relationships. And then figure out what we can do at different stages to help these horses.
Okay, so we've talked about the spinous processes, the articular processes, spondylolisthesis, discospondylosis. My brain's getting full.
I know, right? It's a lot to take in.
But there's one more thing we got to talk about.
Ah, yes, the sagittal ratios. That's how researchers look at the spinal canal. You know, the space where the spinal cord runs. But they have to account for size differences between different horses.
So it's a way to standardize the measurements, make sure they're comparing apples to apples.
Exactly. And the study found something pretty interesting. The sagittal ratio at T1 was smaller in all the horses with neck problems compared to the healthy ones.
So smaller ratio, less space for the spinal cord.
Yep. And less space means there's a higher risk of it getting compressed. And we know that can lead to all sorts of neurological problems.
Wow, so even a small difference in that ratio can have big consequences for the horse.
It really can. It shows us that even seemingly minor changes in these bony structures can make a difference in the horse's health and well-being.
Okay, so we've covered a lot of ground here. What would you say are the key takeaways for our listeners when it comes to these cervicothoracic vertebrae? What should they be thinking about?
I think the main thing to remember is that this area is incredibly complex and we still have a lot to learn. But this research shows us that those subtle changes in the bones, the discs, the alignment, they can have this ripple effect. It can lead to pain, dysfunction, and even problems with the nervous system.
So it's not just about those obvious things, like a fracture or a dislocation. It's those more subtle details, understanding how it all works together.
Exactly. And that's where having a good vet is crucial. If you see anything different in your horse's movement, posture, behavior, anything that just seems off, talk to your vet. Because catching these things early can make a huge difference.
Now, this study looks specifically at warmbloods. What about other breeds? Do they have these same problems?
That is a pivotal question. We need more research to see if these findings hold true for other breeds.
And since we know that spondylolisthesis and discospondylosis often go hand in hand, what can we do to stabilize things early on? Can we prevent those long-term changes?
That's another great question. Maybe things like specific exercises, managing their workload, even making small changes in how we ride and train them. All those things could play a role.
So it's not just about treating the symptoms after they show up. It's about understanding what's happening and helping the horse stay healthy overall.
Absolutely. It's about being proactive and supporting their musculoskeletal health.
Well, folks, that wraps up our deep dive into the cervicothoracic vertebrae in warmbloods.
Lots to think about.
I know, right? I'm feeling a little overwhelmed.
It is a lot to think about, but I think it just shows you, how much is going on under the surface. We see these horses moving, jumping, doing all these amazing things.
Right.
But we don't always stop to think about how it all works, all those tiny little things.
So it's like a machine, right? And a really complex one.
Yeah, it is a beautifully engineered machine. But with all those moving parts, well, things can go wrong sometimes.
And what's really crazy is this study was just looking at a tiny part of the spine, those few vertebrae at the base of the neck. Think about all the research that still needs to be done on the rest of the spine, the legs, all the joints.
It's almost overwhelming when you think about it. But the more we learn, the more we see how everything is connected. A problem in one spot can affect the whole body.
It really highlights how important it is to take a holistic approach. It's not just about fixing one symptom, it's about the whole horse.
Absolutely. And that's where those preventative measures we talked about come in. Exercise, conditioning, making sure the saddle fits properly, being careful how we ride and train them. All those things can help keep them healthy.
So if the next time you see a horse moving, really take a moment to appreciate just how amazing it is, all the things that have to work perfectly for that to happen.
Yeah. And remember, even those tiny little bones we talked about today play a huge role in that.
Absolutely. And if you're a horse owner, pay attention to your horse. You know them best. You know how they usually move, how they stand, how they act. So if you notice anything different, even if it seems small, don't ignore it. Call your vet.
Exactly. Early intervention is so important.
Well, folks, that brings us to the end of our deep dive into the world of cervicothoracic vertebrae in warmbloods. We've covered a lot of ground today, from the anatomy to the potential problems and what we can do about them.
It's a lot to think about, but hopefully it helps you understand these amazing animals a little bit better.
I think it definitely does. So keep those minds inspired.
Hearts light and tails wagging.